Hi, everybody. Welcome back to the Frank and Lizzie show. It is so great to record with you again, Frank. As you know, Frank, over the years, I feel like every time we talk about wound dressing, there is always something new popping up. The innovation has just not stopped, it seems like.
Right. And you know what? That's true, Liz, because in the older days, dressing just had one simple function. Some were barriers, some were moisture absorbers. But you know what? With the patients, with the complexity of patients nowadays, we don't need a one-trick pony. That one-trick pony doesn't cut it anymore.
For sure. I know like our patients, they come in with wounds that require dressings that can multitask and they need to protect it. They need from the patient and the external environment. They need to absorb all that drainage, which I'm sure you know about in the lymphedema space. And we really need like a multitasking dressing, like a superhero kind of dressing.
Right. And you know what? Superhero, yes. We need to say yes to the dressing. And so definitely we have a dressing now that earns his capes and tights, and that's called Biatain Silicone Fit. And I can't wait to hear more about it.
Yeah, so Biatain Silicone Fit is more than just your average foam dressing because it uses a gentle silicone adhesive that sticks softly to the skin, so it's nice and gentle without causing any damage when it's removed. And that's really important for a lot of our patients with sensitive skin or fragile skin, or skin that's macerated.
Right. And so I get it. It's gentle. But here's my question. How does it handle all that fluid? Because you know what, Liz? Wounds can get pretty messy.
I agree. So, this dressing has a super absorbent foam core in it that locks in that wound fluid, kind of like a sponge. But then instead of it wringing out, it stays locked into that dressing. So it really keeps the wound moist enough to heal without being overly wet. That beautiful balance that helps prevent skin breakdown while healing the wound.
And you know what? As a lymphedema therapist, I'm in search of that dressing that can handle that fluid. And so what you're saying is that it manages fluid really well, but also I understand it helps with preventing pressure injuries, or is it just for treating them?
Well, it does both. The dressing provides a cushioning effect that can redistribute that pressure away from the vulnerable areas. And it does great job at conforming to the body shape. And it comes in a variety of shapes and sizes as well. But that foam dressing, because it's multi-layer, can also reduce that shear and friction, which are two of the biggest factors that can cause pressure injuries in the first place.
Wow, amazing. That sounds pretty versatile. Handling fluid and protecting against pressure injury damage. So, Lizzie, is there anything that this dressing does? Is it what makes it special?
Well, it obviously stays secure without sticking to the wound itself. So changing the dressing can also reduce the pain for the patient and lower the risk for the skin, as we discussed. But this is key for patients who need those frequent dressing changes. But I would also argue that I need this in patients where we're not changing the dressing as frequently as well.
Hmm. And you're right. So thanks for that. So it sounds like Biatain Silicone Fit is a top option for managing wounds, especially pressure injuries.
Yeah. It's really a smart choice for wound care. It combines all of those things that we all need for so many of our patients, especially those complex ones.
Yeah. And in my world, what caught my eye, my attention, is that this dressing molds to the wound bed, even if it's, I understand, up to 2 centimeters deep. So it allows the ability to not only prevent the pooling of exudate that happens underneath the dressing when there's space.
Yeah, well, you have to fill in that dead space. And I think that's, sometimes so lost in our training as clinicians, at least in our basic training, hopefully not in wound care training. But that pooling can lead to obviously more infection and also maceration because it tends to then leak onto the peri wound. I did a lecture once with a good friend of mine, Erin Testerman Mintra, and she was always talking about this prevent the plop. And that's where you use a wound filler and then something over top of it. And so when you have a dressing that instead of puffing out towards the environment, moves in towards the wound space and really gets that exudate out, you don't always need that secondary dressing to bring it out in it. So she was referencing preventing the plop means that when you take off a dressing that has like a filler in it, sometimes that like kind of piece of dressing just plops out of the wound if it's saturated. And I can tell you from experience that I've had nurses that would call me and be like, something came out of the wound. I don't know what it is. I don't want to know what it is, but I'm not touching it. And so that ick factor kind of goes away when you can simplify your dressing choices.
So let's do away without the plop. So we get
Yeah.
rid of the plop, and there's not a lot of filler dressings out there, but it kind of allows you to use one dressing and not worry about the filler. So it's a great idea.
Yeah, well, I totally agree. And today we actually get to speak to an expert with this dressing, and I am so honored to have her. We're really lucky to have Christina Richardson. She is a wound care nurse practitioner who works closely with Biatain Silicone Fit, helping her team and patients get the best out of it.
Christina, welcome. So glad to have you. And before we dive into the specifics, I need you to tell us a little bit more about this dressing, how it's used, where you work, and what kind of wounds is it helping manage?
Absolutely. Well, thank you guys so much for having me today. As you said, I'm a wound care nurse practitioner. I work in a really busy wound care center. So I'm not only working in the outpatient capacity, but also we're attached to a hospital. So definitely working with patients that not only come into our wound care center one time a week to be treated in the wound care center, we send them out. We need patients that have simple dressings that one, maybe are being changed by their family members or being changed by themselves. They might have home care nurses, but also then essentially too, they might be inpatient in our hospital. Our hospital nurses might be trying to prevent pressure ulcers, all of that. A really robust type of dressing.
So when you think about the nursing staff that you have at all these locations, would you
Yes.
say this dressing is somehow changing their approach or maybe giving them a little more confidence, empowering them to act sooner, maybe more independently?
Yes, I absolutely think so. And I get a lot of phone calls throughout the day, whether that's from home care nurses, in the inpatient, all of that. They're always seeking guidance on what do we do for this wound. I think when we go back and we think about and we talk about a little bit about those fillers as well, it is really confusing on what do I use a hydrofiber for? What do I use a gel for? And when they have something that can conform to wound depth up to about 2 centimeters, it can pull away that exudate. They get to go to the closet and pick one thing, and they can start their dressing changes. They can go and know and be confident that they're going to give this patient some really good care until someone else can help with that wound. It doesn't mean that I have to run and see the patient right away.
Well, I'm sure that helps with your workflow a ton.
Absolutely.
And I'm sure there's
Absolutely.
too. I mean, when you provide them guidance
Yep.
or addressing where you don't have to hold their hand through it, it seems like that is a no-brainer, right?
Yes, absolutely. Unfortunately, we just don't, when we think about our education in wound care, we get extensive education being specialized, right? In in nursing education, they might have gotten training on a wet to dry.
Yeah.
Even our other clinicians who aren't specialized in wound care, even other physicians, nurse practitioners, PA, it's really confusing out there on what they need to do.
People say there's 6,000 dressings out there. I mean, for a new person learning, and that's really very complex, but I'm very curious, something that we may not talk enough about, but how is that dressing selection complexity impacting the quality of care?
Yeah, I definitely think that the complexity of dressing changes when we don't provide simple instructions
Mhm.
on how to do things, things get missed. So if we decide that we're going to layer 3 and 4 different dressings in a wound, it's not going to happen, right? If we decide that we're going to use one dressing like the Biatain Silicone Fit because it fits what we need to do, and it's going to pull away that moisture, it's going to prevent maceration, it's going to do a very great job of being gentle on their skin. That's really simple. That dressing change is going to get done. It's going to get done accurately, and there's not going to be ambiguity in our instructions. It's going to be a lot easier no matter who's doing the dressing.
Yeah.
Yeah.
Can you share with us maybe like some of your early experiences? Because I know anytime I get my hands on a new dressing, you're always like testing the water and seeing how it is. And then once you get you comfortable with it, you can really use it to its max capacity. So I feel like I would be nervous to be like, yeah, it fills in that depth. And so tell us about your experience when you first started using the Biatain Fit.
Absolutely. One of my case studies. So 93 years old, she had a venous wound, a little bit of arterial insufficiency in there as well, but she has a wound on her malleolus. There is depth to it, right? So I really wanted this dressing to prove to me that it was going to conform to the depth of the wound. However, this one of my first cases with the Biatain silicone dressing, I wasn't, I really wasn't worried about it, not being gentle on the skin. I was most wanting it to really prove to me that it actually was going to conform to the depth of the wound, really prevent maceration. So that first patient, I still put a hydrofiber dressing, large amount of drainage. In the beginning, it absolutely was soaking through the hydrofiber and into the silicone fit. But even with that hydrofiber dressing, that silicone fit, you absolutely could see that concave shape to the foam, that it was moving into the wound bed. I saw a just visible reduction. I was amazed by the reduction in the peri-wound maceration, even with the hydrofiber in there and the large amount of drainage. It really made an impact, and it really proved to me, okay, this dressing does what it says it's going to do. It is going to move into, I can look at for a good amount of these patients getting rid of that wound filler as well.
Yeah, and we can see in those photos how red and angry
Right.
that peri wound looked in the
Yeah.
beginning. And then you can see in those first dressing changes, just, the drainage stayed right in that foam piece.
Right.
And the peri wound is much less angry than it was at that first photo there.
Yeah, absolutely. And I think it does a great job. Sometimes when we've got too much moisture on the peri wound, too much maceration, that skin just reacts in such a way. So I'm glad you brought up the redness. And sometimes it gets confused for certain individuals who are assessing the wound. They're like, oh gosh, it's infected, right? But it
Mhm.
really is just a reaction to just the level of moisture sitting against that peri wound. And so this dressing is great in preventing that and just really helping the clinical outcomes of our patients in several ways.
Yeah, I can't wait to use it because I left 4 different patients this morning and they all have macerations. They all
Yeah,
have lymphedema and a lot of drainage. So can't wait.
yeah,
Yeah, and that fluid can be so caustic to the peri wound too. And I think one of the features of this dressing is that it really has that higher fluid handling
yeah.
capacity. They even did a study and they found that 93% of nurses proactively changed dressings before the protocol said to with regular dressings. But then when they looked at the Biatain Silicone Fit, they performed better in the fluid handling capacity, which can reduce the unnecessary dressing changes, which we all know nursing time is invaluable, but also just the pain to the patient and the hubbub of it, not including the cost of the dressing. So when you're looking at factors like that, it's really important. And I love that you used it on like this venous wound because bordered foam dressings aren't always my first pick for a
Right.
venous or lymphedema wound
Yep.
because I'm concerned about the maceration. But in this
Yep.
case, it worked great. And from that case, obviously that was one of your first cases. Did you find more comfort then in the fluid handling capacity of it? Like, I know you see
I
a
did.
lot of lower extremity
Yeah.
wounds.
Yeah.
So, yeah.
Yes, I absolutely did. And honestly, I think that was one of my like, okay, let's be aggressive. Let's try and use this dressing. Let's get it stocked in our clinic. Let's really try and partner as well with our home care agencies. If we're not ordering supplies for our patients, let's try and have home care order the same thing. So that way our patients get this not just when they're in our clinic, but also with all of their dressing changes.
Yeah. Good. Well, can you share like another case study that shows us like how you grew in that and the fluid handling capacity?
Yes, absolutely. So I have had, like I said, I've used it with several patients. My next patient was another lower extremity wound. She had been in the wounds care center for um, probably several months. She had had several open ulcers, lots of draining wounds. Again, another venous arterial insufficiency. She had had a lot of kind of pitting and fissuring almost. Not fissuring's probably not a great wound for it, but you know what, when you see those lower extremity ulcers and you kind of get the epithelialization throughout it. And so you do have a lot of this pitting. It's not a standard uniform wound that you're just going to be able to put, a good, nice piece of any filler over it. It's just got cavities and crevices, and the silicone fit really did just maneuver very nicely into the wound bed, all of those crevices, pull away the exudate. And in venous ulcers, it's not always a just clear serous drainage. Sometimes there's a little viscosity
Yeah.
to, like you were saying, prevent the plop. It's like there's just this viscousness to the drainage where you've got to really pull that away from the skin. And the Biatain Fit did a phenomenal job of doing just that and helping really prevent the maceration. On a lot of these patients like her, we would have been painting zinc around all of that healthy tissue to try and prevent the drainage from breaking down the healthy epithelialization. And the Biatain really helped us do that instead.
Yeah, I think for those irregular wounds too,
Yeah,
like you don't have to do the arts and crafts of how to create, like put it just in the open
exactly.
areas, uh,
Yeah,
and not the intact skin, like, protecting good skin while treating the open skin can be super
right.
challenging in these type of wounds. And I just love that you show in this case study how the dressing has the drainage just exactly where you don't see it elsewhere. It's wicking
Right.
like into the dressing, but not spreading outward.
Exactly. And you can see it on both sides. I think this case study, I have a picture of both sides of the dressing,
Mhm.
and you can just see it draw its way through that dressing and just really contain. So I've been very impressed with how it draws it through that really good foam core, and it's really been a good addition to my practice.
And I loved everything you said about the dressing because a lot of times I call it chasing the drainage, that we have to add so many different products. Next thing you know, your price per patient cost, your supply cost goes out of the roof. So
Right.
having one dressing that can handle that is well worth looking into.
Absolutely. Yeah.
Yeah, and I know that Coloplast, who makes this dressing,
Yep.
did a clinical study and it showed that while Biatain Silicone Fit had comparable healing to the traditional like two dressing approach with a filler and a foam, it actually was like a 54% reduction in wound area and a 72% reduction in wound depth. But the one dressing method reduced the number of products used by nearly 50%. And that lowered treatment costs by over 33%. So it's
Yeah.
not just like effective, but it's also more cost efficient, which Lord knows all of our health systems are looking at with a fine tooth needle now. It is just under scrutiny so bad. And explaining to them that it's not just a line item, that it's something that would help reduce usage in another area is definitely helpful. To share these numbers with your health system in order to help streamline it. And that doesn't even take into consideration the nurse workload, right?
Yeah.
Yeah.
I do have a question for you, Christina. There's another type of patients that we usually see in the clinic that any amount of drainage could damage, what the advanced product they put in there. So have you used it with camps?
Yes, I have. And again, I have another case study, and actually, I've kind of talked about this case study with lots of different patients. She was a young individual, relatively healthy, majorly healthy patient. She was actually in a traumatic accident, kind of fell out of her airplane, building her own airplane. And so she had a major traumatic injury. And so, with the Biatain Silicone Fit, I started to use that. I did have to send her to general surgery. She had lots of undermining, so I had to originally remove some skin flapping there because there was a lot of undermining. I started then utilizing the Kerasis as the skin substitute, packing into what undermining I had left. Once I was able to remove the wound vac, then I started to utilize the Biatain dressing because I really needed to bolster down the Kerasis and make sure it stayed in place. And make sure, because of course we still had drainage, all of that, that it lifted any of that drainage away from the wound and didn't just let it sit there, macerate wound edges and not allow my Kerasis to do all of the good wound healing that I needed it to do. So if I can use the Biatain and I don't need vac therapy or anything like that, I've gotten some really great results using Biatain in conjunction with, of course, not just Kerasis, with multiple different bioengineered skin substitutes. It does a really great job of still conforming even with that layer of skin substitute on the wound.
What I like about your case study is that you don't see any maceration if you look on the top right, and then also the color of the tissue is beautiful. So to have one dressing support the function and protect the advanced product and also bolster it,
Yeah.
it makes it an ideal product once again.
Yeah.
Yeah. And
Yeah.
we see a lot of clinicians are moving away from using negative pressure over top of a camp product, whatever you choose. Or if they're going to use it, they only use it in the acute care setting and then not outside of the acute care setting. Especially in our elderly population with like fall risk or something like that. They just don't want them tangled up with another tube. And Lord knows the beeping of it. So to have a
Yeah.
product that can help create that intimate contact with the wound base so that there's full incorporation of your very valuable cellular
Yes.
tissue product. Really we talked about how this dressing was a superhero, and we've just proven that it really can handle a lot of situations that we need in our day to day, even in these very complex wounds where we're doing more advanced therapies.
Absolutely.
And actually, Lizzie, it sounds like the Swiss Army knife of the wound care dressing
That's
categories.
a
Yeah.
better name, but that might be patented. So maybe.
And in all reality, our patients themselves are only getting more complex. So
Right.
if we can make our wound care a little bit simpler and easier for people, that's what we need, because our patients themselves are just getting more complex.
For sure. And I know in our area, we have a deficit of home health agencies that are accepting. So to have a dressing that you could instruct a patient to change themselves pretty easily is a game changer, because you don't have to wait for home health or have them come back in, because we know compliance or adherence to a treatment plan is often lacking in our wound care population. And so the easier we can make it, even for the patient, not even for the clinicians, I think the better outcomes we're going to see.
100%. Yeah.
Yeah. And Christina, we talked about what Biatain silicone brings to the table. But let's talk about the other side of it, the patient. You started mentioning patient care. Give us your perspective about what the patient is, experiencing with these new dressings.
The patient themselves is experiencing simplicity. There's the pain, not as much pain. Dressing change frequency doesn't need to, be daily. So when you think about a patient being with a chronic wound, being at home, and trying to have some quality of life, when you don't have to be changing a dressing on a daily basis, and these are, preventing pressure from the wound, no matter where the wound is, you just have so many great benefits, quality of life, pain wise, less expense to them in the long run. So I think there's just been an exuberance of benefit when we're talking about this dressing.
Well, that's
Huh.
great. Well,
Yeah.
I'm looking forward to trying it out. And Frank, I know you just
Yeah.
got your hands on some. We just used one in an outpatient who had a surgical dehiscence with like small depth. And it was great that we could get them to ship it to their house. The patient changed it themselves, no issues, no pain with the removal. So I think it's a great thing to try to use and get your comfort level with it. And I know it's always hard to move away from a product that you feel comfortable with, but I think it checks all the boxes.
Yeah.
Yeah, and I can't wait. I know that you spoke about the plop and Plop. But what I love about this is that I used to call when you have space underneath the dressing, you would get gumbo. And so now we're getting rid of the gumbo and the plop altogether. Christina, thank you so much for sharing this. We want to thank our listeners too, and turn into more of the Frank and Lizzie show as we bring you the latest in wound care innovation. Thank you.
And thank you, Christina. Until next time, be sure to subscribe to the Frank and Lizzie show for the latest updates in wound ostomy and lymphedema education.